The number of coronavirus cases continues to spike in Alabama, and now we are seeing more cases among our younger generation. Dr. David Ansari, biology chair at Calhoun Community College, joins us now to talk more about the coronavirus and its impact on our community. Dr. Ansari, thank you so much for being with us tonight.
Oh, thank you.
Today, Huntsville Hospital CEO David Spillers said there are 5 children with coronavirus hospitalized. He said it is the first time that they have seen this during the pandemic. This week, we also learned a 16-year-old patient with coronavirus is in the ICU. What are the implications of these recent cases among our youth?
Well, unfortunately, with many infectious diseases, there are going to be outliers like that. And so that's really, really sad for any child or young person who winds up with a severe COVID case like this. Sometimes those patients have, I don't know the story behind the 16-year-old, but sometimes those younger patients who do wind up in intensive care or even on a ventilator have some sort of pre-existing condition, like maybe some sort of lung issue or breathing issue that made them more likely to develop a severe case of COVID.
Also today, we learned the Madison County Board of Health has drafted a proposal that would require face coverings to be worn in public places. This week, the Decatur City Council passed a resolution that strongly encourages residents to wear face coverings. From a scientific perspective, is this a good move?
I absolutely think it is. First of all, putting on a mask is really not that difficult. I mean, it's a small thing that you can do. It's an easy thing that you can do. I know they can get hot. They can be a little bit uncomfortable. They might look a little strange, but this is the COVID-19 pandemic is a changing, fluid situation. Information can and will change. So what we consider best practices now may not have been what we consider to be best practices a couple of months ago. But health officials widely believe now that wearing a mask, if you have COVID-19, if you are infected and you don't know it, and say you're in a grocery store walking around, if you have a mask on, that mask is likely to absorb a lot of the respiratory droplets that you release that would contain the virus and would be the main way that that virus would spread from you to another person. It's not a 100% effective thing, but it's very likely to dramatically reduce the amount of virus that you're releasing out of your respiratory tract that could infect others. So I absolutely think the mask ordinances are a good thing. It would be great if we didn't have to pass mask ordinances and force people to do that. Just out of having empathy for other people and caring for other people in our community.
The state announced its back-to-school plan. It includes full-time in-classroom instruction for students, blended learning, which is a combination of online and at-home learning, and full-time online options. We understand that some parents work full-time and simply don't have an option but to send their children back to school. But what is your message to parents that do have an option?
Yeah, that's a tough thing. I'm a grandparent of a 4-year-old who lives with me who will be going to pre-K this fall, and so we're looking at that as well. And it's just it's a changing situation. Decisions that you might make right now might have to be updated 6 or 8 weeks from now, depending on how the pandemic is going. I know that the school systems, we at Calhoun Community College also, for college students, we're going to be doing everything that we can to try to make those schools safe environments, try to do social distancing as much as we can. In college, we're going to have students wearing masks and faculty wearing masks. That might not be quite as practical with younger kids, but and disinfection and so forth, but there's always going to be some risk until this pandemic goes away. And I think as a parent, you just have to decide the pros and the cons. If you can't keep your kids at home and do schooling from home, that might be a good choice to make. But if you're in a situation where you really can't, try to take some assurance that the school systems and so forth are going to be doing everything they can to create a safe environment for the kids this fall.
Dr. David Ansari, biology chair at Calhoun Community College, thank you so much for your time tonight.
Thank you.